Hi, everybody. Thank you for joining us tonight for a candid conversation with some of our amazing team at the Alliance for Eating Disorders Awareness. My name is Lisa Murano. I'm the Donor Relations Manager, and I have the unbelievable privilege of working with these amazing clinicians. So I'm really excited for you all to meet them tonight and learn a little bit about each of them, their roles at the Alliance, some of their backgrounds, and what a typical day is like at our office. So tonight we have with us Dr. Joann Hendelman, Dr. Katie Mittelstaedt, and Liz Motta. So thank you all for joining us tonight on a Tuesday evening, I think it is. I don't know, the days all blur together at this point. So thank you guys for joining us tonight. And I'm really excited to dig in and have our supporters learn a little bit more about you and take some questions from folks. So I'd love to start just by you introducing yourselves. So Dr. H, we'll start with you.
Hello, everyone. I'm Dr. Joann Hendelman, and I'm Clinical Director of the Alliance for Eating Disorders Awareness and the Alliance for Eating Disorders Awareness Psychological Services.
Hi, everyone. My name is Liz Motta. I am a licensed mental health counselor in Florida and the Director of Education and Resources at the Alliance.
And hi, everyone. I'm Dr. Katie Mittelstaedt. I am a postdoctoral fellow with the Alliance for Eating Disorders Awareness and Psychological Services.
Thank you all. And I know for folks who may not be as familiar with the Alliance, they're probably wondering, like, what is a postdoctoral fellow? What does all that mean? So I'm really excited that we can dig into all that a little bit tonight. But first, I kind of want to just talk about, it's the new year. I think any of us that have been on social media have just seen all the, stuff that comes with the new year. So people might be wondering, why are we here talking about eating disorders? Why? Like, is that still a thing? That's something that I get asked a lot. I feel like when I tell people where I work, they're like, oh, eating disorders, those don't exist anymore. But unfortunately, we all know too well that they do. In fact, eating disorders take a life every 52 minutes here in the United States. They are the second deadliest mental illness. Eating disorders affect all people from all walks of life, regardless of your immigration status, your skin color, your country of origin, your gender, your sexual orientation, your socioeconomic background. So we just really want to let folks know that the Alliance for Eating Disorders Awareness has services. We have accessible services nationwide, and we just want to share a little bit more about with y'all what we do. So Dr. Hendelman, you've been with the Alliance, I think, since its founding, or thereabouts, right?
It was probably around for about 2 years before I became involved.
So you are our clinical director. You oversee all things clinical. Dr. H does an amazing job. So I know one of your passion projects has been our support groups. The Alliance has free in-person and virtual support groups. Right now, of course, our in-person support groups are on hold because of COVID, but we have free therapist-led support groups that people from across the nation and really across the world attend. Last year alone, in 2000, we had over 9,300, in 2020, we had over 9,300 attendees, more than 82% increase from the year before. Last year, we launched 5 new virtual support groups. So the Alliance currently has 26 support groups in total across the country. And one thing that I love about our support groups is that you always have that safety of having a therapist in the virtual room. So Dr. H, can you talk about why that's a little unique and why it's so important to have licensed clinicians as part of support groups?
Most support groups are run by people who have had the experience of having an eating disorder. And that can be very valuable in terms of that person having been there, done that, and understanding to a point of where people are at and what they are experiencing. The problem is that we believe in absolute safety for our people who are experiencing eating disorders. And that can only happen with a trained facilitator, somebody who is fully trained in eating disorders, to be able to give the support, to be making sure that we can have as little as possible of problems with being uncomfortable in the group. And also, people are experiencing some pretty severe illness. And by having a trained therapist be able to give them support when they need it is extremely important.
Thank you so much. And it's always such a pleasure to get to watch the beauty of the support groups and just see how great they are. The Alliance, like I said, has 5 free weekly support groups. We currently have 3 pro-recovery support groups. So those are great for anyone who's experienced an eating disorder or is in recovery. One of those pro-recovery groups is specifically for the LGBTQ community. Then we also have 2 weekly support groups for loved ones. So please contact the Alliance if you'd like to join our free support groups. Dr. H, for folks who haven't had a chance to join a support group yet, how does it run? What does it look like when the support group starts to when it's over?
Well, it's interesting, Lisa, because there's a bit of a difference between the face-to-face support groups that we had before COVID. And then when COVID reared its ugly head, all of a sudden it was lock into gear and figure out what we're going to do, because there are people out there who are suffering. And so we recreated the support group to meet the needs of the virtual attendee for our support groups. And what happens in the virtual group is we make sure that we have a leader who sort of arranges to run the group to make sure that not only are we able to talk about issues that people are dealing with on a day-to-day basis, whether it be that they're dealing with life or dealing with their eating disorder. And then we have facilitators, all of whom are trained to work with eating disorders, who can give support. Some of our facilitators are people of lived experience, so they can come from their experience and talk about what that's been like for them. Others are fully trained in eating disorders to talk about what it's like and tools that they can use in terms of getting through these times of COVID. As well as we have a chat space, and in the chat space, people can talk about what's going on in the group, as well as ask questions or talk about other issues. And I happen to do the chat space a whole lot, so I throw in quotes that are hopefully motivating. So it's a place, number 1, of safety, and number 2, of community.
Sorry, couldn't find my unmute button. Thank you for that, Dr. H. And I know we just pasted in the chat the schedule for our support groups. So again, look in the Facebook chat and you can see the links to join. Thank you so much for telling us more about the support groups. Really quickly, I'd like to hop over to you, Liz, and ask about referrals. One thing that I know we hear a lot, whether it's from folks in the community or from other clinicians, is they have a hard time finding where to refer folks for all levels of eating disorder care, whether that be outpatient therapy all the way through medical stabilization. In 2020, the Alliance provided over 188,000 referrals via our phone, our website, and our new Find ED Help apps. The Alliance currently runs the largest and free database for all eating disorder levels of treatment. So it's a great place to find if you're in need, or if your loved ones are in need of any level of eating disorder care. So Liz, I'd love you to walk us through what it's like if I'm a person who needs maybe an eating disorder therapist or whatever level of care that may be. If I'm calling, or if I'm calling on behalf of a loved one, where do I start? What does that look like if I call the Alliance to look for recommendations for eating disorder therapists and providers?
Yeah, absolutely. So at the Alliance, I'm lucky to work. It's myself. I'm a licensed mental health counselor, like I said, and my colleague, Dr. Ali Weiser, who's a licensed psychologist. And so together we take the referral inquiries that come in, whether they be through, phone, by email. Ultimately we're wanting to get on the phone with whether it's an individual or a family member, or sometimes a provider, or a friend, whoever it might be, trying to navigate care. And, you know, Lisa, you mentioned when someone calls and they're like looking for a therapist, sometimes that's the call. And oftentimes I will say it's much more complex than that. Sometimes people don't know what they need. Maybe they've received a diagnosis and then they're really not sure what to do next. So we're able, Dr. Weiser and I, to really meet them where they're at. So kind of learning where they're at in the stage of connecting to care. Sometimes it's a lot of listening, validating, you know, helping them to feel supported wherever they're at in the journey. And then ultimately, you know, the goal is to get them connected. So whether it's helping them to form an outpatient treatment team, providing them with education on what it looks like to get treatment for an eating disorder, you know, explaining to whether it's a parent or that individual that if a higher level of care is needed, then going through the appropriate step down. If you're starting at a higher level of care of residential or inpatient, then ideally stepping down from there to PHP, IOP, and then of course we're going to assist them with, you know, forming an outpatient treatment team. But it's complicated, and you know, sometimes it does take more than one conversation to really help a family or an individual really figure out what resources are available. Obviously, trying to figure out, you know, what insurance is going to cover and all of that. So, but we're here. We work with the families and the individuals to make it work, and are always, you know, ensuring that if there's a hard time connecting with care, let us know. On our end, we'll reach out. We'll be that bridge to make sure that those individuals are connected.
Thank you so much, Liz. It's amazing to me how many calls you and Dr. Weiser take. I know last year you guys did over 40,000 minutes of referrals. That's more than 27 days worth of researching and helping connect folks to the levels of care that they deserve. So thank you. And thank you for explaining what that process is like, because it seems like something that can be overwhelming, but I know with your help and with Dr. Weiser's guidance, you guys really make it a lot easier of a journey for folks. And again, it's free. There's no charge to call Find ED Help or to find our apps in the App Store. It's free for clinicians to be listed. So if you are a clinician who's watching this and you're not on Find ED Help, please let us know. So Liz, I know another big part of what you do is you and Dr. Weiser do our education and outreach. So you all are boots on the ground in communities working with various schools, for everything from younger all the way through medical schools. Y'all are working with community organizations. I know last year you all presented to over 24,000 individuals. 15% more than, or sorry, 156% more than you did in 2019, and that's virtual. Can you tell us a little bit more about the continuing education that the Alliance provides, and if someone in the community is looking for education and some more guidance around eating disorders, how can they get in touch with you?
Yeah, absolutely. And that's something that I'm, you know, I think all of us at the Alliance, but I know me personally, I'm super passionate about is, you know, there's so much misinformation out there. There's so many like misconceptions out there about eating disorders. And so being able to equip, you know, students, obviously, students pursuing higher education, you know, teachers, providers, you know, professionals with the information on what eating disorders are, you know, how to recognize those red flags, those signs and symptoms when they present. We definitely do presentations and trainings that are geared more specifically on a certain topic. We've recently been doing a lot of trainings around eating disorders and trauma and gender-based violence. So, I mean, we definitely have a variety of different topics that we cover. And the goal is, you know, and the goal at the Alliance is to make, you know, things accessible and affordable. So the majority of the trainings and presentations we're offering are offered at no cost. Sometimes when we offer larger training days where we offer, you know, 6 to 7.5 continuing education credits, we might offer a nominal fee. But our goal is really to help with early intervention. So providers are able to recognize if a patient or a student or a client is presenting with an eating disorder, which in many times is going to go unnoticed because of the shame around it, that they're going to be able to detect when an eating disorder is presenting and refer to appropriate care. So, we're definitely open to scheduling training, scheduling presentations. It's something that we love to do. And also that ties into the advocacy work that we do at the Alliance as well.
Thank you so much for sharing all that, Liz. Last but not least, Katie, I'd love to hear from you. So Katie, you are one of our postdoctoral fellows at our Psychological Services program. For those who don't know, the Alliance Psychological Services is the nation's only low-cost outpatient treatment for folks who are uninsured or underinsured who experience eating disorders. So at the Alliance, folks are able to be seen on a sliding scale from $5 to $25 per session, but actually over the past few months, because of COVID, because of the hardships that people are experiencing, the fee per session has really reduced a lot down to $9.26, just to show you kind of the dire need that folks are in for affordable eating disorder healthcare. So Katie, as one of our postdoctoral fellows, can you tell us a little bit about the program, what it's like in psychological services, kind of what a typical day is like in your therapist chair?
Sure thing. So psych services, like Lisa just said, we see folks, all adults, all humans, all genders who are experiencing eating disorders. And the folks that we work with, are uninsured or they're underinsured, so can't afford therapy out in the community. And so psych services was really developed to fill that gap so that less people in our community who deserve care and need care can get it. And what really attracted me to psych services was that we are filling that gap, and that we also don't have a limit to the number of sessions that somebody can get. We treat the outcome. So we treat till people are doing better. So that's a little bit about psych services. And I would say on a typical day, I get to check in a little bit with some of these other lovely women on the call and the other fantastic people of the Alliance. And then I get to work with our clients, with all different humans who are experiencing eating disorders and like eating disorder comorbidities. So a lot of the time, people who have eating disorders don't just have an eating disorder, right? There's anxiety, there's some depression, there's some trauma. So we work with all those things individually and in groups. I also get to spend my days collaborating with other members of our awesome community. One of the really great things about the Alliance, wonderful organization I get to work for, is that we have a really great network of referrals. And so that also includes things like dietitians and psychiatrists and primary care physicians. So I also spend the day getting to talk to other members of my clients' treatment teams to help them get total wraparound care. So not just psychological care, but dietary care and medical care and psychiatric care too.
And speaking from a non-clinician's perspective, it's so special to me to walk into our office pre-COVID, of course, when people were able to come in and see our clients and see how far they've come in their recoveries, especially the clients of psychological services. And like you said, the fact that they're able to be treated to completion at an affordable cost, and even able to get ancillary services like a dietitian, like a psychiatrist, it's just so special. And then of course to get to work with you amazing postdocs who are, on your way to becoming licensed, it's just so amazing. I know that right now we are accepting applications for our upcoming year of postdoctoral fellows. So please check out the Alliance's website if you've completed your doctorate's degree in psychology and other related degrees. So yeah, thanks again for telling us a little bit more about psych services. It's such a special place. So Katie, as the newest member of our team, I want to start with you. What made you become inspired, not only to become a psychologist, but to go into the eating disorder field?
Sure. So I'm a recovered clinician. I experienced an eating disorder myself. And when I was going through that, I knew that if I ever recovered, that I wanted to give back. And I get a chance to do that. And I want to help other people, and I'm helping other people know that life is possible. Recovery is possible. There is life after your eating disorder.
Thank you. And Liz, what got you into the eating disorder field?
Yeah, so I think for me, I definitely, I pursued becoming a therapist and became a licensed mental health counselor, and I worked at an eating disorder residential treatment center, which was very fulfilling. However, I think the pieces that were missing for me were, being able to provide that support and navigation to families and individuals who were kind of lost in the mix. Because so many providers and so many people just don't have that basic knowledge of what it means to have an eating disorder. And I really felt pulled to the advocacy piece, to the education and awareness piece. And so, the Alliance has been in my heart a special place for so long, having volunteered before pursuing higher education. And so it really became the perfect mix of, everything I wanted to do and being able to provide clinical, utilize my clinical skills, being able to provide that support to families and individuals, being able to, sometimes jump into those support groups and facilitate, provide education and awareness. So really, there's just so much wealth that the Alliance offers as an organization that I was drawn to specifically. And yeah, I've never looked back.
Thank you, Liz. And last but certainly not least, Dr. Hendelman, what got you into the eating disorder fields many years ago? I know you started in a different field, right?
That's right. I actually found out about eating disorders when I was pursuing my nursing degree. And it put together the interaction between mind and body, which I was fascinated about. I wanted to know about how the mind impacted your medical stability versus medical stability impacting the mind. And eating disorders was that way of me understanding that. That was in the dark ages of eating disorders. I was able to read pretty much everything I could find in about a week. And I met my first person with an eating disorder in my first job as a nurse. And that's what started me out. And I decided to pursue my further education being a clinician and working with eating disorders. And it was real interesting that as I pursued my work as a clinician and my continued training, I ended up training my supervisors because nobody really knew anything about eating disorders. So I would have to train them about what eating disorders were so that they could supervise me.
Wow, we've come so far and we've got so far to come. I think there's still a lot of stigma, a lot of misconception, a lot of myths. And that's what the Alliance is all about, is smashing those stigmas, creating these conversations, really allowing people to access the care that they deserve. So what is one common myth or misconception about eating disorders, one for each of you, that you would like to just do away with right now? Dr. H.
That eating disorders are a choice. There is absolutely nothing about an eating disorder that is by choice. Eating disorders are genetic illness, psychosocial illnesses. We now know more than we've ever known. And the number one thing that we know is nobody chooses to have an eating disorder. And even the changes that they go on in terms of their body image, the way they act, the way they behave, the issues that they go through, none of that is by choice.
Thank you. I know that's definitely one that we hear a lot. Katie, what's one that you hear that you'd like to demystify?
I think the one that I want to get rid of is that eating disorders look a certain way. So I think it's very important to recognize that all people can have an eating disorder. You can look healthy and be extremely ill. and people of all genders, all races, all ages, all sizes experience eating disorders. So eating disorders, anyone you can look at could have an eating disorder and you wouldn't know it. So there's no specific look of an eating disorder.
Absolutely. And I think it's always interesting. And I love how the Alliance takes into account different backgrounds that folks come from and different influences that they might have and why those stigmas might form and why there might be barriers to even knowing that there's a problem. So thank you. I think that's an important one. And Liz, what's the stigma or misconception that you'd like to get rid of about eating disorders?
I think there's a lot of them. I think one that comes to mind, although Dr. H and Katie stole both of the ones that I was thinking of, is that, you know, if in order to get over an eating disorder, it's just learning to start eating or stop eating, that it's about the food, when it's really it's not. It's so much more than that. You know, what we see are the behaviors and symptoms around food, but really what's driving the eating disorder is all of those underlying issues, whether it's the trauma, the interpersonal conflict, the anxiety, the depression, all of that. And I think many people don't really know that. And so being able to help create greater understanding around that, that's definitely one thing that I feel passionate about for sure.
Thank you, Liz, for touching on that eating disorders, again, aren't a choice, and that often there's so many other things that it's connected to, right? Like we talk about the tip of the iceberg, that the tip of the iceberg is the behaviors that you see, but underneath it's the trauma, it's all this other stuff. And I won't get into the clinical stuff because I'm not a clinician, I'll leave that for you all, but it's all that underlying stuff. And I just love that, Liz, through your education and outreach programs and through psych services and through everything the Alliance does, we're looking at it with those different lenses, with a trauma-informed lens and taking into account different experiences that we've all been through so that folks can really get on their path to recovery. So I know some folks have been asking, how do they get involved in the Alliance? How can someone in recovery, how can someone who's a loved one of someone who's been through this experience, how can they get involved? So Liz, what's the best way for people to get involved with the Alliance?
Yeah, for sure. So, I mean, we definitely have a lot of volunteer opportunities, internship opportunities, which do require an application and connecting with our lovely operations manager, Nikki. But that's definitely something that, you know, we love having interns helping to, you know, give students an experience and help them become more educated and involved. And then, you know, we have a lot of different resources that you can share. So whether it's sharing information about our support groups, about FAED help with your school, with if you're at your place of work, on your college campus. Or if you have a loved one or you yourself are experiencing an eating disorder, utilizing our recovery resources, picking up the phone and giving us a call. I'd love to speak with you, and I'm sure my colleague, Dr. Ali, would also be more than happy to take the time to speak with you. So, you know, we're here and we want to help.
Thank you. And Dr. Hendelman, I know that our postdoctoral fellow applications for the upcoming year are still open. Where can folks find that information if they're finishing up their doctoral degree?
If they are finishing their doctoral degree and completing their internship this year or have completed an internship, they can either contact me directly, they can go on the Alliance website, or they can look us up on apic.org.
Thank you. Another great way to get involved is to join the Alliance's email list and find out about our different events. Of course, in this time of COVID, everything is virtual, but we have some really exciting stuff coming up. I can't share it all quite yet, but you'll be getting some great emails from us soon and some social media posts from us soon about our upcoming Not One More weekend. So save the date for Friday, February 26th. through Sunday, February 28th. We're going to have 3 full days of help, support, and recovery with our team at the Alliance and with all of you wonderful folks across the country. So again, if you're looking for ways to get involved, to give back, to just really stay with a great recovery network, please get in contact with the Alliance, go to our website, follow us on social media. Yeah, so last but not least, I want to hear from you all. What is something that you're looking forward to in 2021? We're 5 days into the new year. So what is something that you're really excited about?
I can go. One thing that I am really hoping that we can all be excited about is getting back in person and getting to see my colleagues face to face, and getting to see my clients face to face. And we are so blessed that we have technology to be able to have transitioned so quickly and continued all services. But I would be lying if I didn't say I'm really excited to get back in each other's energy.